Hello friends, why do I suggest a penile implant to my patients? Why can't I just keep offering medicines to my patients? Because patients don't like medication. Medication it works only in two conditions. One, when the patient is using it for luxury or leisure. He's normal, but he wants to have excessive sex. He wants to have multiple sex timings. He wants to increase his timing. He wants to enjoy with many partners. So once in a while, taking a pill will not harm you. Other condition is when you are still unmarried or you're about to marry and you do want a quick fix solution for some time. But imagine the plight of a patient who is 40 years old, who is married, who has two children but has a young wife, who still has years of sexual function or years of sexual life ahead of him, and you ask him to take medicines continuously for the next 10 years. He will not like them because medications have their side effects. Medications cause headache, medications are not easy to take, they don't always work. After taking medications, you may not feel like having sex. After taking medication, your wife may not feel like having sex. You have to plan your sexual encounter. If you have to have sex on a Friday, you need to take the medication on a Thursday. And on Friday, your wife may not be in the mood. So, suffering from all this, many patients don't like medications and want a permanent long-term solution. But when we offer penile implant to patients on our YouTube video and media channels, many patients complain that this doctor is commercial and is trying to sell an implant. But these patients never talk about heart surgery and neurosurgery and eye surgery in the same way. Why? Do you think that penile implant surgery is that simple? No. Penile implant surgery is a highly technical, skilled process in which a surgeon, after many years of training, places a penile implant beautifully into your penis and restores your erectile function. Many patients go to doctors who don't have that kind of training and they offer them quick fix solutions, and these patients end up coming back to us for revisions. They're not happy with their size, they're not happy with their girth, they're not happy with their length. They come back with pain, they come back with infections and complications. They come back with a poor choice of implant. They are not happy with the choice of implant that the surgeon gave them. This is because they have gone to quacks or surgeons who are inadequately trained in this fine art of surgery. For penile implant surgery, the surgeon needs to be a urologist. He needs to have many years of intimate knowledge about the penile area and the private parts. He needs to have trained at multiple centers in which he has seen all kind of implants and their working, and he needs to at least have 7 to 8 years of experience doing implants in more than 100 patients a year. These surgeons are called as high volume centers. Why? Because these surgeons can offer you the best implant. They can offer you options, they can guide you to which implant to choose for yourself. They can do the surgery with precise technique and give you the results that you want. Because after you get a penile implant, if you still have to go and take medications, if you still have to suffer, then there's no use of undergoing the surgery. In today's patient who is exactly 40 years old, who has a young wife, who really wants to enjoy his life, but is unable to do so because of medications, has chosen to go with a implant. He has chosen a Rigicon Digi10, which is an implant that we are biased towards because of the sizing options, the antibiotic coating, the lifelong warranty, the correct balance between concealability and hardness. And because of this, we offered him the implant and he's chosen to use it. But many different kind of malleable implants from various companies are available, and each implant has their flaws, each implant has their pros, which we have discussed in detail on my channel, which you can subscribe or go through the playlist to understand more. So let's meet and let's see the surgery of today's patient. See how in 5 to 7 minutes we can precisely put a well-sized implant in his penis and solve his problem of taking medications forever. So just watch the surgery. If you also are suffering from erectile dysfunction for many, many years, do not want to take medications or medications don't work, you're looking for a high volume center that can offer you results, and you want to change your sexual life for the better, then you can contact us on any of the given channels or even by email and schedule your penile implant surgery. It's a quick 10 minutes job. It's a daycare surgery. You can go back to your hotel the same day. You can resume your normal daily activities after a day, and maybe in 10 to 15 days, have sex again, and maybe fuck your partner the way you fucked her on the first night.